Hello, my name is James Gaston with HIMSS and HIMSS Analytics, and I'm presenting today with Sarah Gates, Vice President of Research for the International Institute for Analytics, on the Delta-powered analytics assessment. HIMSS Analytics has a passion for helping healthcare organizations know what's next, and if you'd like to check out the website, you can find out more about the Delta-powered suite at himsanalytics.org/Delta. And our partnership and collaboration with the International Institute for Analytics. The International Institute for Analytics was founded in 2010 by Jack Phillips, their CEO, and analytics guru Tom Davenport, who's the Director of Research there. It's the only research firm dedicated exclusively to defining a path toward analytics excellence for all industries. They deliver actionable insights through proven methodology and working with analytic practitioners, industry experts, and faculty. So why do we care about analytics and analytics-oriented intelligence? It's because we need healthcare organizations to unlock the intrinsic power of data and analytics to transform how technology enables the pursuit to improve all aspects of patient care and the healthcare business. HIMSS Analytics collaborated with the International Institute of Analytics to create a healthcare-specific version of the Delta Analytics Maturity Model that Tom Davenport, Jeannie Harris, and Bob Morrison have written extensively about in their book, Analytics at Work. The Delta-powered analytics assessment helps organizations measure their analytic maturity in a quantitative way, using a survey administered to users, providers, and enablers of analytics across their healthcare organization. It provides insight into analytics maturity relative to their healthcare peers and to other industries, and focuses on the 5 foundational areas of the Delta Analytics Maturity Model: data, enterprise, leadership, targets, and analysts. We also provide an maturation roadmap that helps guide organizations in elevating their analytics capabilities. There are 5 levels to this Delta-powered analytics maturity model. Level 1, a beginner. Level 2, localized. Level 3, aspiring. Capable is level 4. And then leaders are at level 5. Again, focused on the 5 foundational areas: data, enterprise, leadership, targets, and analysts. With beginner organizations focusing on things like inventorying their key data systems, identifying analytical leaders, and having a tactical focus to begin to build experience using analytics and clinical and business intelligence more effectively. All the way up to where leaders present capabilities such as internally and externally being recognized for their analytics capabilities, and deriving new ways to leverage analytics for competitive advantage. And analytical tools are broad and deep across the enterprise. To talk more about the survey, I'd like to introduce Sarah Gates of the International Institute of Analytics.
Thank you, James. So we're engaging with hospitals to take the Delta-powered analytics assessment. And if you're interested, the first thing for you to do is to go to the website that James mentioned at the beginning of the presentation. It's himsanalytics.org/Delta. Once you've indicated some interest, we'll be engaging with you to talk more about the survey and make sure you're aware of what it entails from an organizational level and what the product that you'll be receiving is. We'll do a call with the sponsor and onboard your organization, identifying those people who will be responding to the survey and what level of reports you're going to be receiving. Once the sponsors identified the survey respondents, we actually work with the sponsor to communicate internally about the survey, when it will be taken, what's the process. The survey will then be sent to the participants across the organization over approximately 2-week period. We'll keep the survey open long enough to get to the target response rate, and then we'll produce the results. And depending on which level of service you select, you'll either get a standard report, which has a select number of reporting elements in it, and that's available for free, or the premium service, which has in-depth advanced analysis and allows for you to do some custom data analysis that works specifically for your organization. You also get a presentation of the results to the leadership team within your organization. I'm now going to go into just a few more details about our methodology to help you understand why this assessment is so powerful for hospitals and other organizations. We are not just going to be looking at the opinions of one person within your organization about your use of data and analytics. We actually survey 3 groups of individuals across the organization. We want a minimum of 25 respondents from your organization. If we can take as many as you can possibly provide, so hundreds are very doable as well. We want to look at analytics users, those that rely on the data and analysis provided by others to make better decisions. And in the hospital area, that would include physicians, administration, managers, and nurses. We also want to survey the providers of analysis. Those are the people who actually are using the data, developing analytics applications, and providing them to those users of analytics. Finally, we also want to look at the opinions of the analytics enablers within your organization. Those people tend to be in the technology area and or data provision. By identifying these 3 user groups and surveying them independently, we're going to be able to identify where there may be misalignment in terms of the opinions about the importance of certain competencies, as well as the effect, how well your organization is performing those competencies. Now, within the Delta-powered analytics assessment, we are looking at those 5 Delta elements that James mentioned a minute ago. We have identified 33 specific competencies that cover all 5 of those elements. So and they're listed on this slide here. And so we're looking at, for example, under data, how well are you capturing data? What's the quality of the data? How well is it integrated? Are you able to integrate external sources of data? Is the data trusted throughout the organization, et cetera? We're looking at it from 2 different perspectives. We're looking at how important is this competency for your organization to perform their mission, and then how well or effectively are you performing that competency in the organization today. And you can see why there might be misalignment between the ratings of, say, the consumers of analytics and those who are providing on some of these competencies. That's one of the things that we want to measure. At the highest level, we'll be providing you a Delta score. And as James mentioned a few minutes ago, that score is going to range from 1 to 5, depending on your level of analytical maturity. We're going to give you a score both at the overall level and at each of those 5 Delta elements. And you're going to be comparing yourself, not only knowing your own score, but you'll be able to see how you compare to your peers in the industry. We also will be looking at that perceptual alignment between groups at the highest level as well, so between data, enterprise, leadership, targets, and analysts, between the enablers, the users, and the providers, and both importance and effectiveness scores. Now these 2 elements are provided in the standard report. For those who want our premium service, we go into into much more detail about our analysis. First of all, we're going to be looking at each of the 33 competency level, or at that level of specificity, to understand how effective you are at performing those competencies and how important they are. So you're going to be seeing your score at a very granular level, and you'll be seeing how you compare to others in the industry as well as overall. We're going to be looking at the perceptual alignment at that very granular level as well. So you'll understand, do providers and enablers of analytics rate the quality of data much higher than the users? And we'll be able to point out where are those areas that you really need to focus on to bring everyone into alignment before setting out a plan of action to mature your analytics program. We'll also be providing you with a matrix of those competencies that you should target in the short term for improvement to mature your program. They will be aligned in terms of those that are the highest priorities, those where you have areas that you're already doing well in, that they're your key strengths, and you ought to be celebrating how well you've been doing in those areas. areas where you want to improve as you have capacity, and finally areas where you may have there's not much gap in terms of effectiveness, and they're not really important for that organization. So maybe you want to, at least in their perception of it, and maybe want to do some education. So you'll get very, very specific, targeted recommendations coming out of this analysis. When we do the premium service, we present the results to your leadership team through a live webinar where you'll have an opportunity to ask questions of experts in the use of analytics in the healthcare space. And we'll be able to discuss recommended actions and resources that are available to assist you in your journey. You'll also be getting a written report with all of the findings, including all of the data scores and any sort of alignment analysis. James, do you want to take it over from here?
Yes, thanks, Sarah. I appreciate that overview of how the survey works and the collateral and deliverables that are received after the survey is taken. HIMSS Analytics works very hard to help healthcare organizations get their bearings and have direction. And the Delta-powered analytics assessment fits into that by providing direction beyond our current electronic medical record adoption maturity model that is so popular in the industry. NRAM focuses on the acquisition phase of healthcare IT, buying and implementing out-of-the-box solutions. And stage 1 through stage 5 in particular are focused on that acquisition and implementation. Our goal is to help healthcare organizations move into the utilization phase in stages 6 and 7 of NRAM, where you're actually actively pursuing business intelligence, clinical intelligence, financial operational intelligence, and then using the Delta-powered analytics assessment, begin to mature and move the organization into a phase where it's an insight phase. And analytics and clinical and business intelligence are an everyday part of the organization's activities, where you're able to do things like trending analytics, population management, quality analytics, disease management, and advanced financial forecasting. So all these maturity models from HIMSS Analytics work together to deliver that roadmap and insight. The value proposition around the Delta-powered analytics assessment is that it's a standard survey. You can read more about it in the book, Analytics at Work, as we talked about earlier, mentioned earlier. And it's a healthcare-specific model and guidance written around that agnostic model. And it's proven and vetted, and it has a roadmap for capability profiling, investment, and growth for your organization. You can get honest, balanced assessment and feedback and clear direction for improving your organization's performance in this area. You can also work and drive your program using this survey and our HIMSS Analytics roadmap, which is available for free on our website, or you can work with external consultants or the International Institute of Analytics or others as you see fit. So please visit our website at himmsanalytics.org/delta for more information, or email myself or Sarah Gates for further questions or information. We'd be happy to set up a presentation to talk to you about this assessment. Thank you for your time today, and we look forward to hearing from you and talking about analytics.